The setting, Downing Street, and a press conference led by Prime Minister Gordon Brown detailing the initiative. The partnership is funded by many health agencies and foundations, including the World Health Organization and the donor governments of Norway, Germany, France, Italy and the Netherlands. Mr. Brown said this was an opportunity to literally save millions of lives and triumph over diseases like polio, TB, measles and eventually malaria and HIV/AIDS.
This unique and historical alliance, bringing together all the leading health agencies, is an unprecedented coalition, and it is our best chance not only to sweep aside the killer diseases that I've talked about, but to meet the Millennium Development Goals which the world set only 7 years ago, and of course to bring an end to the suffering and poverty that is caused to so many millions of people. And while we have made advances in these last 7 years, for example, 130 million children have been immunised in a movement to eliminate polio, 500,000 women still die unnecessarily every year in childbirth, 1 every minute. 10 million children do not reach their 5th birthday. In some of the poorest countries in the world, they are fighting diseases with only a handful of doctors and nurses. In Mozambique, represented here today, for 20 million people, there are just 500 doctors and 4,000 nurses. Our aim is to reduce child mortality by 2/3. We know poor countries find it costly and time-consuming to deal with so many partners, over 40 bilateral donors, 26 agencies, 20 global regional funds, 90 initiatives on health. So we commit today to better coordinate our efforts in support of countries' national healthcare plans. Meanwhile, our partners from developing countries have committed to develop their health plans that will reflect the needs of all sectors of society and to increase their public funding for health care.
The idea of getting rid of a lot of red tape fully supported by the Norwegian leader, Prime Minister Jens Stoltenberg.
This partnership is launching more coordination between a lot of donors, countries, UN agencies and others to coordinate and to establish one program, one national health program, and thereby reducing bureaucracy, reducing paperwork and mobilizing more money for actually what is important, namely health for people in the developing world.
The plan will initially start with 7 first-wave beneficiaries: Burundi, Ethiopia, Kenya, Mozambique, Zambia, Cambodia and Nepal. Mr. Brown said there was no greater cause than that every man, woman and child in the world should be able to benefit from the best medicine and health care. That wish has now begun.
Looking together. That's it.